Hey guys, Smile Doc here. Do you have dental anxiety going to the dentist? Well, I've got some answers that just might put your mind and your heart at ease. All right, guys, thanks again. Welcome back to the channel. I appreciate it. Please hit the like button and subscribe to the channel. Share this with some friends if you find the information to be interesting. Also, don't hesitate to comment below, all right? We'd love to hear your questions so we can answer them for you. All right, so let's get right in. Dental anxiety, huge. One of the top 3 questions that I get when I'm on TikTok, and I'll get thousands of comments. One of the top 3 is always, I'm afraid to go to the dentist. And I have to say, it is real. Dental anxiety is real. I mean, heck, it's uncomfortable. People always ask me, what do you do if you have fear of going to the dentist? I don't like going to the dentist, okay? I have fear going to the dentist. No one likes to go. We'd all rather go buy a pizza or go get ice cream, you know what I mean? It is something that is not comfortable. You get people that have really good home hygiene. They never have cavities. They go and get their teeth cleaned, and when your teeth are clean, people love it, right? Your teeth feel good. And so they're like, oh, I love going to the dentist. It feels so good afterwards. But if you've got to go in to get crown work done, root canals done, extractions done, implants done, even fillings, a lot of times they can be associated with discomfort, which makes people don't like them. And then they start telling stories, it spreads, and people get anxiety and they don't want to go to the dentist. And they end up neglecting their dental health for years and years, and then it becomes unbearable and it seems like it's not overcomable. So believe it or not, some studies have shown that 80% of the people that go to the dentist don't like going. 80%. So you are not alone if you're one of those people. And 20% of the people are actually scared of going to the dentist. They are scared. So every time they go, it is an act of courage, and I give you an applause for coming to the dentist. I personally don't like going to the dentist. I don't like going. It hurts. The shot hurts. It's uncomfortable. Get tugged on your cheeks and lips and getting stretched out if they don't use Vaseline and stuff to keep things nice and moist. So, you know, you gotta know what you're up against a little bit. So I have a couple of things that are gonna really, really help if you have dental anxiety, okay? Here we go. My first response always when I get people that ask, what do you do if you're afraid of the dentist? My first answer is get a new dentist. I know that sounds terrible, but if you don't trust your dentist, if your dentist has hurt you in the past to a point where you're like, I don't want to go back, it may be time for a new dentist. Sometimes dentists aren't patient with people that have anxiety. And even that, the impatience of a dentist can put people off and make them not want to go back to the dentist. So interview the dentist, okay? This is not a country, luckily for us, where you get what you get and you don't pitch a fit. So you can go to any dentist that you want and interview them. Tell them, I'm coming in. I'm not paying for an exam. I want to interview the dentist and make sure that we have personalities that are simpatico. And if they won't do that, then that dentist isn't for you. Most dentists would gladly meet you, okay? Gladly meet you. So sit down with them and let them know about your anxiety. That's very, very important that they know. And you'll get sort of vibes from them. You know, are they warm? Are they comfortable? Are they comfortable treating someone with anxiety? And what they have done in the past when they have patients that are anxious. And just let them talk. And interview 3 or 4 of them, and one of them is going to make you feel like, give you the warm fuzzies and make you feel like this is where I want to get my dental work done. Show up to that interview with that dentist very prepared. Have questions that you know you want answers to. If you get a chance, try to meet some of the team members that are there, get a tour of the office, become familiar. All of those things are going to make it more comfortable for you when you come back for the day when you got to get some anesthesia. Okay, it's going to be a familiar place, and familiarity often breeds trust. And a higher degree of trust decreases your fear. It's just natural. So some people want to know what the dentist is doing and others don't. I feel like if you know what you're having done, what's being done, maybe not all of the details, but generally that will put your mind at ease. Like, all we're doing is adjusting the tooth now. All we're doing is touching the filling now. This part here, the dentist is like, this part, it's going to pinch a little bit. Okay, I got to give you a little anesthesia, but I'm going to go slow because the faster I push that medication, the more it's going to hurt. So they're letting you know what they're doing, sort of holding your hand along the way. I really like that. Another thing people hate about the dentist are the sounds, and I have to agree. If we could make a silent drill, we'd be millionaires, okay? But we can't. They have air-driven ones and they have electric ones. Both of them make whining sounds depending on which drill that you're using. And so, you know, that's just how it is. So we got to how do we overcome those unwanted sounds that make you kind of cringe or even get chills? My advice is bring some headphones. Find a podcast that you like maybe Smile Doc's Philosophy. But seriously, find a good podcast that really distracts you and that you can kind of immerse yourself in. Get noise canceling ones. If you get the ones that kind of stick on the outside, you're still going to get a lot of those external sounds coming in. So make sure you get noise canceling headphones. The ones that cover the ears are even better. You won't hear anything, and that is often magical, okay? Those drills, by the way, some of them have noisy sounds and they feel differently. Sometimes even when you're numb, you'll feel a little pressure, and other times you'll feel vibrating, okay, like, and there's nothing that can be done about that, okay? You should not feel pain. It should not be too cold and freezing on your teeth. You should be numb, okay? But you can't get rid of some of those vibrations. You can't get rid of the higher intensity vibrations or the lower intensity vibrations, and you can't get rid of the pressure. You just can't. So you're gonna feel them messing around. It just should not hurt. Okay, there's a difference, right? You can feel stuff. You can feel people messing, but it shouldn't pinch, okay? It shouldn't hurt. I often suggest dress comfortably, okay? Bring an extra sweater. Sometimes it's cold in the dental office. If you have a weighted blanket, bring it. Okay, when you're laying back in the chair, you'll put that weighted blanket on. It will just sort of make you feel secure and safe, and they're very, very effective. But a nice, comfortable clothing will also sort of help you relax a little bit. Sweats, right? The dental office is a great place for sweats. Once you eliminate some of the sounds and you're in a comfortable environment, you're dressed comfortably. If you're still like too anxious, still gripping the chair, even though you can't hear anything, then I'm going to suggest maybe you need sedation dentistry. Now, this video is not about sedation dentistry, but I'm going to talk about it for just a second, okay? There's a couple of different types of sedation dentistry. People think nitrous oxide is sedation, and it isn't, okay? It is an analgesic, which means it does help with pain. It does make you feel a little floaty. I mean, it does. So if you're into that, then you can use it. We don't offer it because I don't find that it's all that effective, and it's very expensive. But there's different types of drugs that you could take that also will take the edge off. The easiest sort of sedative that you could take is a Valium. It's one you'll take the night before and you'll take the morning of. You do need a driver, and so, but it sort of takes the edge off of the anxiety just a little bit. Valium does work wonders for people that need just a little bit. The next layer of sedation that you could get done is with triazolam or Halcyon. These both have retrograde amnesia effects, so you won't remember the things that happened during the dental appointment. However, it's slow acting. Okay, so this is something that you'll take an hour before the appointment, and then usually if the dentist is well trained, they'll crush the pill and drop it right under the tongue where the mucous membrane is really thin and there's vasculature right behind that. It will dissolve quickly into the tongue, and within 20 minutes or so, you'll start to feel some of the effects of it, and you will go to sleep, okay? They all snore. One of the problems with this type of sedation is it's called conscious sedation. You're actually awake. You're just sleeping. And when I say awake, I mean I don't mean to say you're actually awake. You are arousable, okay? It's called conscious sedation because you are not unconscious. You're just sleeping. And you're arousable. That's the best way that I can describe it. So I can nudge you on your shoulder and say, hey, open a little bit wider. And you're like, what? Huh? And you'll open wider. You won't remember any of it. We have patients that sometimes remember just a little bit right at the beginning of the appointment, but generally speaking, you won't remember any of it, okay? So that is a wonderful thing. It is something that's going to require a driver, and for the rest of the day, you really shouldn't make any major decisions, right? Don't go to the bank, don't meet with lawyers, don't close on a house, don't do anything major. That stuff takes, the rest of the day to wear off, all right? The third way, if you're like, that is not enough for me, I need to be out, out. Like you see in the operating room, like I want to be asleep. There's not very many dentists that offer sedation dentistry that way, the heavy sedation. There are some that do it. You might want to find a residency at a hospital, like many hospitals have dental residencies, and these residents do provide sedation in the office, IV sedation, where they can really deepen that sedation a little bit more. And for the very, very worst case scenario, actually in the OR where you are asleep, and I mean, you are out, like general anesthesia out, that can also be done. Keep in mind, as you tier up these levels of sedation, they're going to be more expensive. If you're going to be put to sleep for dental work, the dentist wants to do all of your dental work in one appointment, okay? It's just doesn't, you're going to spend money for the sedation alone, and if you only do one crown and you got a whole bunch of other stuff to do, every time you come in, you're going to have to pay that sedation fee. The risk goes up because you're being put to sleep more often. I mean, it is very safe. Very, very safe. I'm not really worried about that, but I don't want to be put to sleep more often than I have to be, okay? So the last two tips that I want to mention is ultimately, this is a hard truth, but in life, we have to do things that are good for us, that are uncomfortable for us. And dentistry is just one of those things. It's like immunization shots and other things. Like if you have to get moles removed or whatever, nobody wants to get numb and have the little things cut off. Nobody wants to get shots, but it's one of those things, you know, that in the end, it's going to be better for my life if I do it. And so you just got to do it. So figure out ways, hopefully some of these tips help, but figure out ways that you can distract yourself and not be so worried about the dentistry and be anxious about that. The last tip that I'm going to give, again, people don't want to hear this, but an ounce of prevention is worth a pound of cure, okay? I'm telling you, do the fillings when they're small. If you're scared of the fillings, you're going to be very scared of the extraction in the implant, okay? So pick your poison. You want one that's not so bad or one that's a lot worse, okay? I'm just saying, to get a filling done is really low-level intensity as far as what we do in dentistry. And so if you can just stay on top of things, get the little cavities fixed so they don't grow into big cavities, if you can take the extra time and energy during the day to do the flossing and the brushing like you're supposed to do, if you can spend a little bit of extra money getting cleanings and, you know, professional cleanings, x-rays done, having an exam done twice a year, you know, people are like, dentistry is so expensive. I promise you, none of the preventative stuff that I'm mentioning is nearly as expensive as neglecting things for years because of anxiety. Then you're really hit with a bill that is expensive, okay? So spend a little bit, invest a little bit of money on the front end, invest a little bit of time at your at-home care, see your dentist, see your hygienist, and then you watch 5-10 years from now where you don't have all of the dentistry to do that some of the other people that have anxiety will have to do. They didn't want to invest in those things early on, and so they're going to pay the price later on. I hope that this video has been helpful for you. I really do. Please like this video and subscribe to the channel. It's because of you that I continue making these things. So as long as I know you're liking it, I'm going to keep producing it. All right. Again, hit me up with any questions on Instagram. You can drop them in the comments section below. We're on TikTok, Real Smile Doc. Looking forward to meeting you out there and seeing you real soon on the social media train. All right. Again, I hope that, thanks for sticking with me. I hope this video has been worth it for you. Smile Doc out.